This video is for chronic lumbar disc herniation, and we'll be doing traction. And so with that, our goal of the treatment is to decrease the patient's pain by reducing some of the compression on the spine and on those discs. And with the traction, we will be allowing some of the disc protrusion to realign itself back in line with the spine. And then this modality is indicated because we're not in an inflammatory phase, and it should help relieve some of the patient's pain because it is decreasing that compression. Contraindications at this point that we would want to make sure of is we want to make sure that the movement is not contraindicated. We would want to make sure that they're not in the inflammatory phase, like I said. We would want to make sure that there's no joint hypermobility, and we also want to make sure that there's no uncontrolled hypertension, or we don't want to increase the symptoms distally as well. With that, as always, we want to assess the skin and assess the sensation and cognition and make sure that the patient is able to provide good feedback during the treatment. And then for the selection of the parameters, we will have the patient prone in an extension. We will be doing an intermittent 3-to-1 ratio of a hold time of 60 seconds and a relaxed time of 20 seconds. And the force of the hold time will be 50%, and the force of the relaxed time will be half of that. So that'll be about 25% in this case. And then we'll be doing that for starting out about 5 minutes just to get the patient used to it for the first time. And then we'll probably do about 20 to 30 as time goes on. And then we'll probably do that about 2 to 3 times a week. And then doing this modality, I'll be doing mechanical traction because it would be easier with my lack of strength to be able to manually do that at the lumbar spine. And then other considerations, I would want to make sure that the patient is comfortable and that I'm not increasing their symptoms at all and that they're tolerating the treatment well. And then other interventions that we could do is we could do like an extension program to help with that realignment and to help use those ligaments. And we could also do some exercises and do heat and some stretching. Okay, so I have my patient here in a prone position. The reason why I did this was because it will allow more extension of the lower back. And so with that, I gave her a pillow up here so that way she could be more comfortable. And it's also allowing a more extended position here.